Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Health Adviser. Welcome, Dr. Raja.
Thank you, Madison. Happy to be here.
Our topic today is healthcare coverage for college students. Dr. Raja, what are some specific healthcare plans for college students?
So there are several. So it depends on the age of the college student. So if a college student is below the age of 26 and they, in that situation, they can actually stay on their parents' health insurance. The parent can basically claim them as a dependent and they can be on their parents' health insurance. So if they are on their parents' insurance, there are two different things you can do. You can either live with your parents in the same state, maybe not live with them in their home, but even if you're living in the same state as them, that works out well. Or if you happen to live in a different state from your parents, they can still claim you as a dependent and you could be on your parents' health insurance. You just have to report that you live in a different state. Now, if you do not want to stay on your parents' insurance or your parents do not have insurance or are unable to put you on their insurance, then there is an option referred to as the healthcare marketplace that the federal government and the state government kind of together offer as options. And what this is just a website, but a student can go onto the website and there are many healthcare options available to them and they can pick one from that would best suit their needs.
So what benefits and services are typically included in these plans?
That's a great question. So before I answer that, Madison, quickly, just to go back to the previous question, if a student is on campus and they have the university healthcare plan, that works perfectly as well. That qualifies as having health insurance. To answer your second question about what are options that are available as part of the healthcare plan, so it's basic preventive care for the student. So if you need to get your annual visits done, annual health checkup done, that would be covered under your health insurance. If you need to see a physician, say you get sick and you need to go see a doctor, that would be covered as well. In some healthcare plans, you may have a co-pay, that a small amount of money that you have to pay to go see a doctor at that moment in time, but it would be a negotiated, relatively smaller dollar amount that you'd have to pay. That, and also there's some amount of medication or prescription coverage that would be allotted for you through your healthcare plan.
So why should students have health insurance?
It helps to have health insurance. It's like a protective backup plan for you so that you are sure that if a scenario arises where you get sick or you run into an issue, you have a place you can go to. You will have access to a physician quickly that you can go see, and you don't have to worry about, am I going to have a lot of money on hand to pay to go see a physician at that moment in time. And it's also, as a parent, I can say this, it's a relief when we know that our students our children are okay and they are covered by a healthcare plan. We can be confident that they will have access to a service should they need it when they need it, and they aren't in a bind at a bad moment.
So are there any options for financial assistance to help college students afford healthcare coverage?
Right. So when you go to that healthcare.gov website and look for that, look through that marketplace for an appropriate health insurance, it is based on your income level. Or even if you do not have an income, you're not earning money, there are plans in place that you could pick from that would suit your situation. So it may not look like a financial assistance, like a loan kind of thing, but the marketplace is set up in a fashion where students will have the ability to pick the appropriate plan that makes sense for their situation, whether they are with their parents, on their parents' plan, or not on their parents' plan. They're on their own. They can pick and choose based on what makes sense for them given their financial situation.
Dr. Raja, you talked about the marketplace offering different options based off of income. Does NSU offer that as well?
So that's a great question. So the marketplace does offer those different options for people of healthcare options based on their income. Now NSU, when NSU offers healthcare options for students, there aren't different brackets based on income. It's more if you are a student, here is what's available for you. And there's some leeway there. Like you could say, I will take like a base plan that will cover the basic preventive medicine for me. Or if you are someone who needs to get medication on a regular basis, then you might want to opt for an option where that is also covered in the NSU's insurance plan. So it's those kind of options, but not necessarily based on this is my income, so is this the option I should pick out of NSU?
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.